and distinguished panel. Thank you. Okay, first question, Dr. Rav. Could you please comment on the importance of widespread trauma awareness and how important it is in your view?
Thanks, Sue. I've never sat on a panel after doing breathwork, so this is the first time, and so forgive me if I'm so relaxed and don't get my facts out. But it couldn't be more important in terms of the idea and the concept of trauma awareness in one's recovery. I just completed a certificate of trauma stress studies for the last 7 months. It was held by a guy called Bessel van der Kolk. He's pretty famous, like Gabor Mate. And the opening slide, the opening lecture, was a painting by Peter Bruegel. It's called The Fall of Icarus. And I'm sure we all know the story of Icarus. He was this adolescent, didn't listen to his mother, wanted to get wings. He got these wings on and he jumped from a cliff, close to the sun, plunged to his death. And the painting encompasses him plunging into the sea, but a beautiful ship and tranquil waters. A very famous British poet, W.H. Auden, looked at this trauma painting through his trauma lens. And what he said is all of us go through significant human misery and trauma, and it can radically change our lives. But the world continues on in a very monotonous and mundane way. And that is exactly what happens with trauma in society. Most trauma is invisible. Most trauma is not something you see in the newspapers, of course, now with the Ukraine war and the shootings. In America, we see a bit of that, but most trauma is behind closed doors. Most trauma is interpersonal. And the source of trauma for children are their caregivers. The source of trauma for women are mainly from their partners, and for men are from other men. What is trauma, though? A psychiatrist from America, a guy called Charles Whitfield, he captured the definition of trauma very eloquently, and it's quite a very simple definition. It's any event, usually a non-ordinary one, that causes harm to the body, self, or spirit. So when I work in office private, 50 to 70% of patients who come to see me have adverse childhood experiences. And the surprising bit is a lot of them have not spoken about it. And that was quite, intriguing, because they've been in the system, seen doctors before. Now, I can't talk about trauma awareness without talking about the impact of trauma. And I can't talk about the impact of trauma without talking about the ACE study that you alluded to, Sue, which is one of the breakthrough studies in the trauma field. So there's this chap called, I'll be very brief, a chap called Vince Felitti, who, in the 80s he was an internist in San Diego. He ran a really successful kind of weight loss clinic. And there was a patient of his who lost about 120 pounds. And she came back 3 months later and she put on all the weight. And he goes, "What happened?" You're very probingly curious. And she says, "I went back to work and there's a chap who asked me out on a date. And she has a history of sexual abuse, and the default was to pile the weight back on as a way of being safe." So he became kind of curious about this, and he said, "Okay, it looks like I'm trying to treat the solutions that patients have developed for themselves to protect themselves." And he came up with the ACE questionnaire, which he sent to middle-class, white, educated people in San Diego. 25,000 people he sent the questionnaire to, 17,000 responded. And the results were fascinating, because from this cohort of people, you still saw 25% of them endured physical abuse. 25% and more had problems with addiction. 20% had a history of sexual abuse. And 10% had emotional abuse. And the list goes on. Now, the connection, the association with trauma and mental health and trauma and physical health was borne out very clearly from this study. So with trauma, you get associated with smoking, ischemic heart disease, strokes, cancer, respiratory problems, diabetes, obesity. You also get mental health problems, anxiety, addictions, personality disorder, there's substance use. So we see a wide and varied effect and impact of trauma. It's so important to be trauma aware. And there was this chap working with Felitti, a guy called, I can't remember, I think it was Robert Ander. Yeah, it was. He was a computer analyst for CDC, and he kind of looked at all the figures, and he apparently had a tear in his eye when he saw the figures and said, this is an endemic, it's an epidemic. This is a huge public health issue. If one were to remove childhood trauma, you would take away 50% of depression. You would take away 50% of domestic violence. You would take away 60% of suicide attempts. You will take away 65% of alcohol issues and 78% of drug issues. And that's how big the problem is. So Felitti went on to say, I like this line, he said, traumatic experiences are lost with time. And they're usually clouded by secrecy, shame, and social taboo. A study in New Zealand showed that it takes 13 years before someone who's been sexually abused talks about their trauma. There you go. This is how important it is to start the conversation about trauma awareness. Thanks.